Oncology TV at ASCO 2015. Thomas Baldrick with Dr. Brandon Meyers from McMaster University and the Juravinci Cancer Center, north of the American border. Thanks for stopping by.
Thanks for having me.
So let's talk about your work with the Cochrane systematic review and meta-analysis of adjuvant therapy for stage 2 colon cancer. What exactly did you set out to do here?
So this is an area of colon cancer management that has been debated for the last several decades. It is an area where typically stage 3 is very cut and dry of how patients are managed, and those are stage 3 patients where they have lymph node involvement, and chemotherapy clearly has benefit there and is pretty much the standard worldwide wherever you go. Stage 2 colon cancer is a different category, and some of the stage 2 colon cancer patients actually do worse than some of the stage 3, and the factors that are involved in that are a little unknown. Part of it may be that patients aren't getting chemotherapy, but it's also that there are some factors within stage 2 that they don't all behave the same, and so some of those patients probably have a rate of recurrence that's even as higher than some stage 3 patients. And so there's been multiple analyses, and these are statistical ways to look at other studies. And the issue of stage 2 is that it's a population that does better. So if an individual study was going to be conducted, the thought is that it would require around 4,000 patients. And for a study to accrue rapidly and give results, that's really not reasonable. And so a number of analyses have been undertaken by different groups, including Mayo Clinic and Cancer Care Ontario over the last several years, with updated analyses showing trends to benefit, but not translating into survival benefit, which it depends who you ask what people factor as important, whether disease recurrence or overall survival are key outcome measures. But in this latest analysis, we have the largest pooling of data. Now, this is not pooling of individual data, it's published results that are available to anyone.
So how are you pooling all of this data?
So we actually use the published results that provided data on stage 2 colon cancers. We had a number of inclusion criteria of studies that we would include. The biggest thing is that these are studies that included a control arm, which has not been done recently in this day and age. So it's been hard recently to have studies where you have a control or observation arm where it's just simply observation done after surgery as the standard treatment.
So what discoveries have you made based on where you are at this point in time?
So I don't know that this is so much of a discovery. Really, there's been a lot of groups that have published previously showing suggestions and trends that chemotherapy has a benefit, and this updated analysis is really the largest that's been published to date, and specifically looking at chemotherapy that is used in this day and age, essentially. And what we found is we actually now found both a survival benefit and benefit for disease-free survival only for newer chemotherapy. And when I say newer chemotherapy, that's standardly what's used of 5-fluorouracil with no additional drugs.
So how about further investigation?
So I think really the next step with this population is moving the way a lot of oncology is, and that is moving to molecular testing to identify patients who have molecular signatures or a phenotype that suggests that they could derive larger benefit, and specifically targeting those patients. And studies like that may be able to show a larger benefit because you're treating the patients who will likely derive larger benefit and avoiding treatment in those who may not have the same benefit.
Dr. Meyers, thanks for coming by, joining us, and sharing news of your work. We appreciate it.
Thank you.